Phage therapy is a promising new acne treatment that utilizes bacteriophages, aka phages, which are viruses that selectively target and kill bad bacteria on skin and help to balance the skin's microbiome. In this episode of Beyond the Headlines, Dr. Emmy Graber, the founder of the Dermatology Institute of Boston, talks to Dr. Varma, a microbiologist and the founder and CTO of Phage, a line of acne-fighting products that uses phage technology and has been getting lots of media buzz lately.
Hi, I'm Dr. Emmy Graber, and I am a board-certified dermatologist in private practice in Boston, Massachusetts, where I see a lot of acne patients and run my own practice. I'm also very involved in the American Acne and Rosacea Society, and I'm excited to be here today with Dr. Varma, and he is the founder and CTO of Phage Therapeutics. And this is a relatively newcomer in the acne space, and I'm really excited to be talking him today about something that's really on the new frontier. It's novel in acne treatment. We have a lot of things that have come out in acne over the years, and a lot of them we consider to be these Me Too products or these Me Too drugs that are kind of similar active ingredients to what we've always had before. But this is something different. And so we're going to be talking today about Phage, a new product that contains bacteriophages to help treat acne. So Dr. Varma, welcome. I'm so excited to be talking with you today about this.
Thanks, Emmy. Great to be on, and I'm really excited to talk about phages.
Great, great. So, tell everybody a little bit about why did you get interested in phages and using them to treat acne? Tell me your beginning story, I guess.
Yeah, well, my fascination with phages goes back years and years, 20 years now, when I first heard about them or read about them in grad school. And I remember my immediate reaction was, why isn't this a thing? Why isn't this a technology that's more widely adopted? Because phage technology fundamentally is able to be a very powerful antibacterial and have certain sort of advantages to it that make them a very intriguing counterpart to antibiotics and many other antibacterial products in therapy. So my overarching question was, why isn't this more widely or at all an ingredient in drugs or in products in the West? And that led me down to exploring the very interesting sort of political history of sort of phage technology, which was affected by the Cold War, et cetera. But fundamentally, I spent a lot of time following the science, what was being done to sort of study phages and their applications to human health, but also look at companies that were making progress and trying to, build products with this technology. And so, cut to about probably 10, 12 years later, I had the opportunity to kind of put my own ideas into practice. And when I did that, I looked for a condition that would be a perfect fit for this technology. And we identified acne for a couple of reasons, right? Because first, it's, surprising that acne, although it is the #1 skin condition just by the number of people, 85 or more % of people get it. I'm sure all the providers listening to this podcast will be nodding along saying, yeah, I see a lot of acne. And yet, I think I heard this at a conference. I don't remember who said this, but they put it so well. They said, well, we use antibiotics, that's 1950s technology, and we use Accutane, that's 1980s technology, but we, really haven't had something significant since then.
Right. Right.
And, when you put it that way, it is kind of stark because although obviously Accutane and other, retinoids are so effective, but they do have a safety profile that, requires guidance from the provider and some follow-up work.
So let's just back up for a second here, just so I can keep everybody in the know who's listening to this. When we're talking about bacteriophages, we're talking about viruses, right? Bacteriophages are viruses that can selectively kill bacteria. So this is really novel.
Yeah, it is. Bacteriophages are tiny viruses that kill bacteria. They have kind of two superpowers. They are very effective killers of bacteria. So it's estimated that every 48 hours, about half of all bacteria on Earth are killed and turned over by phages. So this is sort of a
Wow.
biomass turnover on a planetary scale.
And we all have them, right? We all have bacteriophages. And I think I started this podcast even pronouncing it incorrectly. So it's bacteriophage, not bacteriophage. Is that right?
It can be both because the person who discovered them was French Canadian, and so he would have said Phage, which is the French pronunciation. But I guess in America it is Phage because
Okay.
that's
Okay.
that's
So,
just the
so now we
phonics
know.
of it.
So now we know. So
Yeah.
they're on all of us, whether we're American or French, and these
Mhm.
bacteriophages are viruses that can kill bacteria. And so you're right. This is novel. It's a new way, if applicable, to perhaps treat acne. So how did you come to think that they would affect acne or even the bacteria that causes acne, the Cutibacterium acnes?
Yeah, so obviously Cutibacterium acnes plays a very central role in the pathogenesis of acne, right? We can start with the where and when of acne. So, for example, kids don't get acne. You never see a 6-year-old with acne. It happens at puberty, and what happens at puberty is before puberty, your skin, the skin of a child, does not have very much C. acnes at all. At puberty, there's a big sort of change in your skin that's driven by a lot of hormonal changes, right? So your pores deepen, they start producing a lot of sebum, and these are the prime conditions for C. acnes colonization. So at puberty, with all of these changes and with hormonal fluctuations, C. acnes comes to dominate the pore, the pilosebaceous unit, and that's when acne starts. Now, you also note that acne only affects us in the kind of what's known as the sebaceous part of our skin. So that's our face, our upper chest, and our back. And that is precisely where the sebaceous glands are most active. And that's really important because C. acnes as an organism has kind of dominated a part of our skin where a lot of this oil is produced because it has figured out how to use this oil as a carbon source really, really well, much
It
better.
feeds on the oil. That's how I think of it, right? Cutibacterium acnes feeds off of the oil, and that's how it survives.
Yeah, and it does so in a way better than any other organism on our skin, which is why even in healthy people, C. acnes can be 80, 90 or more percent of all bacteria on your face, which is a staggering amount. And yet, we tolerate it. It's meant to be on our skin. Now, a great jumping off point for us was that in 2016, there was a study that looked at the microbiomes of people with acne and people with healthy skin. And they did a deep, sort of unbiased metagenomic analysis. The only difference that they could find between the two was that people with healthy skin have quite an abundance of C. acnes bacteriophages. So the phages that specifically kill this C. acnes bacteria. However, people with acne, it was quite rare to find these phages. And more interestingly, they did an elder cohort with healthy skin, so 55 plus. And what they found there was that they had the highest recorded percentage or prevalence of these C. acnes phages. And so, this kind of points to a phenomenon that we all know and we all kind of observe, but we don't have a good explanation for, which is that acne hits you hard when you're in your teens, then it starts to fade away. Why, right? Like in your 20s, 30s, 40s, by 40s, very few people have acne. And we generally think it's because it's the evening out of the hormones, which obviously has a lot to do with it because women have like that hormonal cycle and hormonal acne is associated with it. However, phages could be another part of this. And so if you think about it, the phage eat the acne bacteria. If you have them, you're healthy. If you don't, you have acne. That kind of sparked in us a question of, well, what if we just take the phages and make them accessible to everyone?
Yeah, I mean it's so interesting. So the phages, the way I think about it, with some of those studies you cited, are the body's own defense mechanism against C. acnes. And in people with acne, that defense system needs to be replenished. And that's where your product Phyla comes in, right? It's in a way perhaps replenishing our defense system against C. acnes. Is that too simplistic of a way to think about it?
No, I think that's exactly the right way to think about it because, C. acnes is so intricately um, involved in acne pathogenesis. And if you think about the four classical stages of acne pathogenesis, right? First is hyperkeratinization. Second is increased sebum production. The third is C. acnes colonization and overgrowth, right? Now, the first two conditions are necessary and sufficient conditions for C. acnes colonization because C. acnes is an anaerobic bacterium, so it needs hyperkeratinization to plug the pore so that anaerobic conditions can develop for its proliferation. And secondly, it needs that increased sebum production because that's the food it feeds on, right? So only when those two are met in a large enough number of pores will you start seeing that acne. It's really well studied. I mean, we've known about C. acne's involvement in acne for, I think, almost 100 years now. But we know now the specific pathways by which it degrades the fats into fatty acids, which are irritating to the skin. It produces a lot of these virulent proteins that kick up some immune system markers. And then the C. acnes really drives inflammation, which is the fourth step in acne pathogenesis. And the inflammation is really your immune system sort of always sampling what's on your skin. And when it samples that overgrowth, it kind of sends up this alarm, which is inflammation. So our question was, if we can use phages to control, not eliminate, but control the C. acnes level on the skin, can it reduce the inflammation and, make the acne go away?
Yeah, that's really interesting, and I know you have some good data to show that patients who are treated with the Phyla products with the Phage technology, that their acne reduces, but also their microbiome, their skin microbiome, the diversity of the microbiome increases, which we know that there are studies that show that if you have a more diverse microbiome, this is a healthier microbiome in relationship not only to acne, but also to some other skin diseases, right? Like psoriasis and atopic dermatitis. We also want to see a really diverse microbiome. So you have some good data that shows that the Phyla products do help to restore the diversity of the skin microbiome, and not only reducing C. acnes or the pathogenic C. acnes, as we know there are all different types of C. acnes, but reducing the pathogenic C. acnes. And I think that's really exciting because this is something completely novel. I have patients all the time that come in to see me and they've tried so many things and they want something new. They don't just want another topical retinoid. And they certainly nowadays I hear more and more often, I don't want an antibiotic. And not only are they saying they don't want a pill antibiotic, they don't want a topical antibiotic because patients are aware of their microbiome and they're worried about disrupting their microbiome. And so I think this is a great product to help those patients feel that they may be restoring their microbiome and helping their acne. And so that's really exciting. Um, how, how do you envision that this is a product that will be able to be used alone to treat acne or in conjunction with other things?
Yeah, so in the clinical trial that we ran, which was an 8-week trial that was, double-blinded and controlled, and randomized. So, we wanted to conduct a trial that was as close to the kind of RCT that you would do for a drug. We were really looking for kind of mechanistic insights and stuff that will help us understand how this technology works, not just in a test tube, but like on the skin, right? And we were very pleasantly surprised when we saw that, significant reduction in acne from baseline for the phage cohort. But what we're seeing in this very short 8-week study, which is shorter than a normal acne study, is that the phages work on average, or for most people, it has the best effects starting at 8 weeks, which is about 2 months, and it has the ability to work by itself. Now, the interesting thing about phages is, or this technology, is that it's very, very specific, right? So it's killing the bacteria responsible for acne, but not affecting the good bacteria. And that gives it an incredible sort of profile, not just in safety, but as you mentioned, in increasing microbiome diversity, because we also know that people who have acne have lower microbiome diversity. And it's thought if we can just kick that up by some mechanism, we can actually improve their acne. So here's a mechanism by which not only are you getting your acne under control, but you're able to increase microbiome diversity. And for us as well, we want to study this more. What effect does this have on long-term microbiome diversity? So I think these are really interesting. And because of the mechanism of action that is non-interfering with other medications, other approaches to acne, this makes it a really interesting and hopefully very useful sort of tool to add to your arsenal as a provider, someone who sees acne a lot.
Yeah, it's always great to have another thing to offer patients who come in and they rattle off, 10 or 15 things that they've already tried. So it's nice to be able to offer them something new and something novel. So I really look forward to hearing more about Phyla Therapeutics in the future and your Phyla products. And right now, over the counter patients can purchase Phyla online in doctor's offices. How should providers direct their patients to these products?
Yeah, we have a lot of providers recommending Phyla and directing people to our website. We are also available on Sephora.com. We wanted to remove barriers to access with our product, and we were able to build a technology that fortunately was able to provide that increased access. So providers can point people our way. We are at phyla.com, phyla.com.
Well, it was great talking with you, and I certainly hope to hear more about Phyla in the months and years ahead.
Thanks, Emmy. Thanks for having me.
Thanks for listening to this episode of Beyond the Headlines.